used to be at MetroWest Health Foundation. So while I was there, we had embarked on thinking through how to do some mass in motion programs in collaboration with mass in motion programs in terms of working on childhood obesity. So this is how this session came about, is we wanted to really bring to you some of the key things that we thought worked really well. So this is around our version of healthy outcomes, because I thought that this collaboration was a really wonderful example in terms of thinking about cross-sector programs coming together. So I thought I should first let you know I'm Ramani Sripada, and I work now at Associated Grantmakers. And I thought we might just go through and just have everybody introduce themselves.
Hi, I'm Rebecca Donham. I'm Senior Program Officer at the MetroWest Health Foundation in Framingham.
I'm Tammy, Calise. I'm a Senior Consultant at JohnSnow Inc. and the MetroWest Moves Project Coordinator.
And I'm Barry Keppard. I'm the Manager of the Public Health Division at the Metropolitan Area Planning Council.
So we came together, we thought we would really wanted to have this an engaging time, so if people have questions, we want you to just raise your hand and ask them as we go along. We're going to talk briefly, and I'm just going to take the group through a little bit around 3 key areas, looking at how we got started, and looking to Rebecca at MetroWest Health Foundation, how the foundation became involved in doing this work, and then collaborating with some of the Department of Public Health and mass in motion programs, and then looking in terms of putting a tri-town collaborative together, which includes Framingham, Hudson, and Marlborough. And Tammy's going to tell you about that third. But Tammy is actually the program coordinator for the MetroWest Moves program, and she's going to give us some updates on that. I'm going to be talking to Barry about some of the key things that MAPC had put together for this project, and they have been a role as doing some amazing technical assistance work. So I'm looking forward to hearing more about what they've been doing, and then they'll be sharing that with you. So I'm going to start with Becca Donham, and I'm going to ask her to tell you a little bit of background in terms of how this whole program got started in addressing childhood obesity, and how some of these partnerships were fostered and brought together.
Thanks, Ramani. Good afternoon. I want to start with a statistic and a little poll. So Massachusetts has the most public health authorities in the country, approximately 351. A few have merged, so we have a few less than 351. You know, we like our home rule, tax tier stays here, you know. So what do you think the next highest state is? And how many public health authorities do you think there are? Any guesses? Yes.
California, 35.
Nope. Anyone else? Yes.
Colorado, 30.
No. One more guess.
5.
It's actually Georgia, and they have 100. But you know, between 100 and 351. I bring that up just because it gets to sort of why we're interested from a public health perspective. So the MetroWest Health Foundation was an early funder of childhood obesity. You feel like sort of now we've got the First Lady on board, the Harvard Pilgrim Healthcare Foundation, a lot of funders are in it. But we started in 2005 by funding individual physical activity and nutrition programs focused on kids and some local policy change work. We also had a billboard campaign, very public. We sort of on NPR, everyone was like talking about our billboards. And I would say sort of after a $3 million investment in all the programs we funded, you know, we knew we had raised the visibility of the issue, but we weren't really sure that the individual programs themselves had overall contributed to a decline in BMI and the sort of future reduction in disease, which is why we were interested in the topic. So we sort of began to think about sort of how could we reconceptualize the program without sort of throwing out the issue, because it was still very important. And we started looking towards sort of Shape Up Somerville, which was sort of more of a, how do you get a whole community to get together to think about ways that the community itself can change policies, the landscape, the way the whole town thinks about obesity. So in 2008, we made 2 planning grants, one to Northborough and one to Franklin, to start thinking about community-wide initiatives. And sort of around the same time, Massachusetts Department of Public Health launched Mass in Motion, which was based on the successful Shape Up Somerville. And they came to us and they said, we would like to sort of fund some programs in Metro West. So we kind of, in this creative cost-sharing model, we said we would fund Northborough and Franklin through sort of the MetroWest Moves to get so that they could be part of the technical assistance and the policy work that was being done as part of the cohort of Mass in Motion. And I will say, as a result of funding that, Northborough saw a 20% decrease in childhood obesity rates in the sort of years where you get BMI screenings, which was that was significant. It still is considered very, very significant. And then in 2011, one of our trustees, Joel Barrera, who works for MAPC, came to our board and said, that the CDC was thinking about sort of doing these grants focused on chronic disease, including childhood, including obesity, and they're going to make sort of funds available from the feds to the states. So at that time, we, going back to that regional thing, we approached the city of Marlborough and the towns of Framingham and Hudson, who had some of the higher childhood obesity rates in the state or in our region, and we said, how about developing a regional approach, not even community-wide, sort of regional, 3 towns, to get together and work as sort of one cohort. So MAPC wrote the grant on the part of the Massachusetts Department of Public Health. It was for Middlesex County. It was funded, and 3 of those towns, Marlborough, Framingham, and Hudson, are included as sort of one cohort. And the foundation has committed to matching funds up to $60,000 each year. So my sort of takeaway from that is, even though we were sort of starting to think about pulling away from sort of childhood obesity, and we weren't sort of ready to go to the next shiny new thing, as we just learned, we still recognize the importance of obesity as it was related to health, but we were looking to refine it, and so there were lots of things that aligned. The success of Shape Up Somerville, and then sort of Mass in Motion, and really sort of the early work we did in Northborough, seeing such a huge success. And then for us, going back to that 300, when you have, so we fund 25 towns, so there are 25 local boards of health, and most of them are staffed by part-time public health agents who basically all I can do is restaurant and septic inspections. There are 10 essential functions of public health, so local boards of health can do about 3 of them. So we thought, sort of, isn't this a way of sort of really trying to get communities to think broadly in terms of maximizing impact on public health? And that was our interest, and I think I'll now turn it down to Tammy, talk about how it actually worked.
Well, let me ask you a question first,
sure.
Rebecca. So what were some of the challenges? Because in trying to get everybody together, it wasn't so easy, even historically in thinking about how it all came about, and even working with Northborough and Franklin. So if you could talk a little bit about some of the challenges, like people, because there's all those different boards of health, it is really challenging to get folks to work together.
Yeah, and I will actually say that I was not the program officer responsible for these grants. It's actually Ramani. So I may actually throw that back to you. But certainly in terms of doing anything regionally, sort of this it is sort of this taxpayer stays here. Everyone wants their own domain. Framingham is 65,000 people, but it's a town. There's no city, so there's no, sort of mayor who's kind of wants to embrace it. You've got sort of selectmen, and it's just sort of this really. It can feel very parochial, and we often at the foundation say our work would be a lot easier if we were in Boston, where people were more used to sort of regional or efforts that are bigger than them. MetroWest, you've got these towns and they all want to own it, and yet their infrastructure and capacity is tiny. And sort of this idea that, well, who's going to get the money, and well, we want it, and we want it for this thing only. So to my mind, sort of the idea of sort of how you think about sort of public health and sort of not just trying to get at those other 7 essential functions of public health to actually do them. But I don't know. You tell me, what were some of the challenges, Ramani?
Well, I mean, the overall goal, actually, when we were doing the collaboratively working with the Department of Public Health, is trying to reduce childhood obesity by 5% in 5 years. So that's quite a challenge. I think one of the things early on is just even in thinking about how the program was set up is to be working in coalition with people that are not just from the boards of health, but working with other kind of municipal leaders. And this was one of the challenges that came because a lot of people didn't feel like this was something that they wanted to spend their time and energy on. So I think early on, just building that leadership from the towns, or in our case, in the city from Marlborough, but trying to build those early on with Northborough and Franklin. And then we also had a little glitch, which is that the Department of Public Health was starting to collect data in terms of BMI results. And they were doing that across the board and across districts. But Franklin was one of those towns that didn't want to participate. It was the only town, right? It was the only town that didn't participate. So early on, it was difficult for us if we were going to be doing this project and thinking about how that would measure and what we would put that against. But eventually, they did come around. And I would say that's because a lot of push from the foundation, actually, from MetroWest Health Foundation, in working with Franklin to try to get them to think about what is the benefit of this. And I think we actually had some clear wins. And even with Northborough, with some of their coalition building, they really were able to bring planners on board. They were able to get people that they wouldn't usually have these conversations with. And I think that was really one of the clear outcomes, is that you got people working together that were not used to working together in this type of project, even in their individual towns. So that was probably step one. So I thought, Barry, I would ask you a little bit around MAPC's role and thinking about some of the work that, and how you got started in working directly with some of the programmatic components as well.
Thank you. Thank you all. So again, my name is Barry Keppard. I'm the manager of the Public Health Division at the Metropolitan Area Planning Council. And if you're not familiar with MAPC, we're the regional planning agency for Metro Boston. And so what that means is we do municipal planning and other activities across a set of 101 cities and towns. So if you can picture I-495 and bring that all the way into the city of Boston, those are all the cities and towns that we're touching. And in the absence of something like a county, there's no real entity. You essentially have this municipal level insularness, and then you have the state level existing there. And back in 2008, 2009, we finished our most recent regional plan, which is called Metro Future. And in Metro Future, we touched on a lot of the issues that I think fall kind of more within traditional regional planning. So talking about land use and urban planning, transportation planning that's occurring, dealing with environmental planning issues. But through the process, what we began to hear with the people that helped us build the regional plan, that worked with us to bring all this information together, was that there were issues that we weren't touching on that we needed to include and look at in our work. And so that touched on issues related to education, clean energy, but then even more so, it kept coming back to this theme of public health, and that we should be involved in working with issues related to public health. And so I think that was back in 2008, 2009, and we started to kind of get our wheels underneath us and begin to look at different pieces of information that we could use to help us to move into that way, and look at how our work affected what sometimes we refer to as like social determinants of health or physical determinants of health. And one of the things we started out with was back in, I think, probably 2011, we had a document called the State of Equity for Metro Boston. If you ever get a chance to look at that resource, it really lays out essentially from a life stage perspective, those who are young, middle adults, seniors, and what type of issues they have and what type of choices prevent them from realizing certain outcomes. And key within that is kind of health outcomes and whether or not people have choices to realize those certain health outcomes. So really, as we got that off the ground, we were able to move in some directions, and through partnerships, we were able to go in some really strategic directions. One were related to health impact assessments, and we're using that to kind of look at more sometimes project or program level changes. But looking at things that are related to the built environment and how that affects whether or not people can be physically active if they have that choice, what type of choices do they have in terms of accessible and affordable fresh food, but even tobacco-free policies as well too. And then even lastly, where the clinical settings and healthcare settings we have, how does that communicate and connect with our community settings? So know when someone gets out of the doctor's office, are they going to find that support in the community around it? So then that was essentially driving the work that we were doing and the work that we wanted to get into. So as the community transformation grant for Middlesex County came along, it really allowed us, again, in partnership, to step into that space with lots of different individuals in our region. So in addition to MetroWest Moves, there's another 6 sets of communities that were identified for mass emotion programs of getting them off the ground. And it's been a great experience for us because it almost feels like we're being like an explorer. Like we've given this charge to go out and explore this landscape and see how our work connects to public health and essentially bring that information back into the fold. And so what we've essentially been doing is essentially looking at this work that's been going on the ground, providing technical assistance in those areas that we do have as a regional planning agency: land use planning, urban planning, transportation planning, environmental planning, housing, being able to bring that into the mix so that when an opportunity presents itself, we can be there with the technical assistance and the resources. But even more exciting than that, and Tammy will talk about this a little bit more, is we've been able to forge partnerships where we've been able to go even further and explore other grant and funding opportunities. So it's been really great to kind of see that where we meet up, where we can complement each other, and where resources that we have, either kind of technical assistance or in-kind resources, can be put up against resources that are being flexed at the local level by local foundations. So I'll stop there.
And it's really a testament to the leadership. I mean, I know that we've been hearing this as a clear theme in the conference as well when you're looking locally and talking about philanthropy. It is a testament to the leadership at MAPC, because not every organization that's doing the smart growth and all of that and the planning really always thinks about public health, even though it is such a clear marker in terms of looking at your community and the neighborhoods and whether it's making a difference. I know you had some TA projects, but you also, I think one of the things for Massachusetts, which this is unique about community transformation grants, were federal grants that were made out into the community, and then in the Department of Public Health, Mass Department of Public Health, these were called Mass in Motion programs. So this came together. So the Department of Public Health had a grant for the federal government from CDC, but so did MAPC. So this is unique in the nation because we're the only state that got 2 grants for doing and addressing childhood obesity in this kind of comprehensive manner. So just so folks know.
And just to add to that, I think one of the things that's unique about it as well too is that whereas kind of federal funding has certain limits on it and certain restrictions on where that funding can go, that's been one of the great benefits of being able to partner. We've been able to walk some of these things further. So whereas the guidance or even in some case policy work has to stop and can't be done by federal funding, but through MAPC, through our funding and through our expertise, we're able to kind of use that and kind of guide some of those changes as well too, so that we both have the technical assistance and be able to walk that into those system changes that we're looking for, the system changes.
Yeah, and this is why this is such a unique kind of partnership. You're not really seeing this anywhere across the nation, especially to address childhood obesity in this manner. So it's pretty comprehensive. Well, Tammy, I want to have her talk a little bit. Now, she's the coordinator and has done some fantastic work as she came on. I got a chance to work with her really closely on putting together some of these key strategies. And I think it's hard enough bringing 3 communities that aren't used to working together, but they actually came up and agreed on these strategies. And I have to say, in those early stages when people were still trying to figure out what they were going to do, I give them a lot of credit and leadership, but a lot of that facilitation was, including with MAPC staff, myself, but also when Tammy came on, just really clearly had already been working with us at MetroWest Health Foundation with both Northborough and Franklin. Well, Northborough more so. And but if you could tell us how you got started with this program and a little bit around what are the key strategies and some of the progress and outcomes that you're seeing.
Sure. So I want to start out by saying I've been involved with Northborough since 2008, so helped to coordinate that initiative, and I want to answer one of your questions that you asked Rebecca, which was what was challenging, and I think certainly what's challenging, but that Northborough really was successful in, is bringing those diverse partners together. So they do have the planning director, they have the director of youth and family services, they have the Parks and Rec director, the public health agent, and so in a way, because Northborough was a small community, they all knew each other. They didn't know how to necessarily speak one another's language, but they did know each other, and so it was a lot easier for them to come together. The challenge that I had in helping them kind of to plan and move forward, and certainly what I've experienced in my career in public health, is that we all kind of get stuck on programs. We want to put together the walkathons and the give out the tchotchkes, the t-shirts and the water bottles. It's a lot harder to do the policy planning. It's a lot harder to change the environment to support the healthy behaviors. And so that was, that's kind of been the real struggle. And it's absolutely amazing in Northborough that the things that have happened to see the reduction in the BMI, like all elementary schools have changed recess to be before lunch, which is a huge policy change. And the principals and the teachers will talk your ear off about how successful that has been for both academics, but also getting the kids to eat better and to be more active. So I'll stop with Northborough, but I was involved with Northborough, which helped me to become involved with the MetroWest Moves project. Just since we keep talking about Mass in Motion, it's a statewide initiative where 52 cities and towns are representing roughly 33% of the state population. So specifically, MetroWest Moves is covering the town of Framingham, Hudson, and the city of Marlborough. We have 4 specific strategies to try to accomplish this goal of ensuring that MetroWest Moves and its associated communication activities facilitate opportunities for people who live, work, play, to engage in healthy eating, active living, and smoke-free living. We have a huge, let me start. Okay, so the structure of MetroWest Moves is very different than other mass in motion initiatives in that we don't have a coordinator sitting in town hall per se. The structure is 3 very different communities working together. So you're bringing diverse partners together across the community, but also the diverse sectors. So you have the boards of health sitting with the planners, sitting with the town engineer, sitting with community development. And so when the opportunity arose, JSI, JohnSnow Inc., which is a public health research and consulting firm, applied to be the project coordinator for these 3 communities, saying, we're not going to have one person, we're going to have a team. So I sit here representing a team. We have a media specialist. We have a variety of people that we can pull on strengths to help go out and accomplish our objectives and our strategies. That being said, our work is really driven by the steering committee of these very diverse partners across these 3 different communities. So we get together on a monthly basis to sit down and say, what should we do next? And so JSI never says you should do this. We know the research and the literature, and we can help make informed decisions, but it's really coming from the stakeholders in the community as to what the work is. And I often say we're kind of the wheels on the bus. They're the bus and we're the wheels. We're doing the work and making them look wonderful. So that's kind of our structure, and again, different than other mass in motion communities. As I mentioned, we have a huge community awareness initiative to really get the word out to residents in the community, but also to the different stakeholders, different organizations within each of the communities. So we do a bunch of partnership outreach, reaching out to anyone from the schools to the senior centers to advocacy groups to try and understand what their goals are and how their goals are aligned with the goal of increasing physical activity, healthy eating, and smoke-free living in MetroWest. We understand that we aren't going to do the work. We're not going to be able to accomplish everything in these 3 communities, that there are many organizations within the communities that are doing wonderful work. And so through our marketing, we help to bring awareness and attention to the great work that our partner organizations are doing in the community. So we do a bunch of tweeting, we do newsletters, sending them out to the schools. We do a bunch of posting online. We have a website, and also just traditional newspaper print for our partners and for the different events that we're going on. We also have held a tri-community event where over 75 organizations came, and we had a kind of a shotgun presentation style where we had organizations stand up for 2 minutes and tell us what they did as it relates to the MetroWest Moves. And so what we heard from that opportunity is that it was a wonderful way for the different organizations across these 3 communities to be able to learn what else is going on and to build on one another's strengths and to network. One of our main strategies is healthy dining, and so we partner with local restaurants to make healthy food options available to customers. We're not telling the restaurants that they need to change every item, but we just are asking that they help us to identify at least 3 different menu items that our registered dietitian will approve for lower calorie, low sodium, and lower fat items. And as a participating establishment, we do a bunch of marketing for them. We just had an event in November, kind of tagging off of the Boston Restaurant Week. So we had a healthy dining week in Northborough, Marlborough, Hudson, and Framingham for 10 days, and we estimated to have reached over 120,000 people through our media. So the restaurants are getting a lot of free advertising by participating, and then in our conversations with them, what they have told us is that they have really appreciated the participation because their customers come in and they want healthier menu items and they don't want salad. So what we have done is to really try to provide healthier options that don't equal salad for the customers. And the restaurants are really, they really are understanding that, this is helping, again, to bring attention to them, but also to bring business to their establishment. So it's kind of a win-win for everyone. We also have a strategy on community design where we're really working with our partners to not only maintain existing infrastructure, and I'm going to turn it back over to Barry for a few minutes to talk about the community innovation, which seems to be the buzzword of the conference, but a community innovation grant where we partnered with them, MAPC, to help these 3 communities to apply and to receive a grant to prioritize repavement. So I'll let you talk a little bit about that, and I'll come back to this.
Sure, and so one of the things, again, having this partnership that we learned is that this idea of having kind of an approach towards what we consider complete streets, so essentially planning for a place that accommodates all kinds of users, pedestrians, motorists, bicyclists, but also taking into account the age spectrum, so that from the youngest kid who might be walking to school to the older adults and seniors who might be in our communities and aging in place. And one of these ideas as we began to think about guidance related to this is what does it actually mean, and how do you actually plan for it? And so through a Community Innovation Challenge grant, which is a state grant program for regionalization services, best practices, we're developing a tool now that'll actually be able to work with DPWs, city engineers, and be able to say, if you're going to prioritize these investments, this is where you want to target these investments, and we're going to use kind of a geographic mapping system and some other data to do that. So it's, again, by having these conversations with those people that Tammy identified earlier, we'd be able to identify, yeah, we can take that step, but we don't know what it means when we actually take that step. So it's been a great way to kind of blend this together and continue walking this work forward.
Thank you. We've also helped these 3 communities to apply. Unfortunately, we weren't successful, but to apply for grants to try and improve the design of the community to help the aging population through sidewalk improvements. Unfortunately, again, we weren't successful in those opportunities, but we are trying to reach out and to receive additional funding through this MetroWest Moves project. And so that's the maintenance of existing infrastructure. We also are working on new development. So again, we worked with MAPC and some of the consultants to help identify a checklist where we would give to the planning boards to say, if it's new development, can you please review this checklist and try to approve new development that meets criteria that, again, will create these communities that are more bike and pedestrian friendly. Another strategy that we have is tobacco control, which again, we helped these 3 communities to apply for a regionalization grant to the MetroWest Health Foundation to try to kind of tag team on one another's policies for tobacco and tobacco-related products control. So the 3 communities actually reached out more into the region, and there are 9 communities that are working on a regionalization of tobacco policy, including e-cigarettes. We've also been working with landlords in Framingham, Hudson, and Marlborough to try and encourage them to go smoke-free. And we get a lot of technical assistance, again, through MAPC and Department of Public Health. We've held events where we've invited local landlords to come. We've offered up some free legal counsel, at a minimum, but also free or templates of leases and other policies to, again, try and convince them to go smoke-free. We demonstrate or give them information on the cost savings that they will see if they were to decide to go smoke-free. So we have gotten a bunch of landlords on board. We're also working with work sites to promote healthy eating and physical activity. We help to share the best practices and policies. So, for example, Bose has a wonderful worksite wellness program, and we've helped to share some of the things that they've done at Bose with the other work sites within the tri-community area to, again, raise awareness and to promote partner worksite information sharing. We've held worksite wellness tax credit seminars for small businesses who may not have the resources like a Bose to have this big, wonderful worksite wellness project, but to demonstrate to them if they were to make small changes in worksite wellness that they could be eligible for a tax credit, and through that worksite wellness, we have started to build a relationship with Marlborough Hospital, who has a new CEO and very interested in doing some worksite wellness, but also as a large employer and just a large agency within the community. He is also interested in helping to make some changes in the food environment for the patients and the visitors as well as the employees. So we've begun those relationships. And that's really come through in establishing a relationship with a very passionate physician at Marlborough Hospital. And so our work, has really been with him to help to get him to understand that it's not just about his individual patients, but that the role that he can have to advocate for a larger change through policy. So he's really been on board to make the relationship with the Marlborough CEO and Marlborough Hospital CEO. And so again, we've started those really great relationships. And also through that, we worked with Marlborough Hospital, MetroWest Medical Center, the YMCA's in the area, as well as MAPC and a bunch of other partners came together to apply for a Prevention Wellness Trust Fund through the Department of Public Health. There were 9 grants awarded, and the MetroWest Moves group was one of the 9. So we're definitely going to see a big increase in clinical community linkages to address hypertension, pediatric asthma, smoking, and elderly falls. So while this initiative really started out to increase physical activity, healthy eating, and smoke-free living, the cross-sector partnership across the communities has really allowed us to spring off onto addressing other major concerns in these communities. So I'll end by just saying, as we kind of started out, that the programming piece, trying to convince folks that it's more than just doing a 5K and giving out t-shirts, but that it's really about doing multiple strategies that really work towards policy and environmental change, and that really if we work together that our efforts will be reinforced, maximized, and amplified. And I would say that while it has been challenging, it has also been very successful to have these very different communities come together with the different sectors, because we can learn from one another. And Barry and I were just at a meeting not too terribly long ago about trying to work towards having these 3 communities adopt a complete street policy, and we were kind of stopped in our tracks because town of Framingham sets has a whole different policy structure than the city of Marlborough, and Barry can talk more about that kind of language, but one calls it a bylaw, one calls it an addendum, and one calls it a policy. So it's kind of all of that, trying to get these communities to make change, but in the operating structures that each of these communities have. But certainly the frequent communication across the communities and across the different sectors has been really important and valuable. As I mentioned about the physician, finding a good leader, certainly we have great leaders on our planning boards, as well as community development and the planning boards. So without them, our work would have been a lot harder, and really learning to build on one another's strengths and reach out into the communities has been extremely beneficial. So I'll stop there.
Thank you so much. So I want to just recognize and give a round of applause to Rebecca Donham, Tammy, Calise, and Barry Keppard. Thank you. And I want to open it up now to the group for questions.
Yeah, I'm curious, first of all, is that all that you did? Nice job. Were there stakeholders in the process that you felt that you haven't done as good a job, including engaging with, and what are some of the challenges around that?
Yeah, so
Assuming there's no perfection.
no perfection.
Yeah.
Well, so that's, that again has been one of the challenges with this 3 community initiative. While in the town of Hudson, we have really great buy-in and relationships with the school staff. It's not as desirable in Marlborough, for example. And so when we have to do a yearly work plan, DPH really wants to try and make sure that the strategies that we put forth for the upcoming year will be able to accomplish those in the 3 communities. So that's been somewhat of a challenge, because I think we would have gotten really far in Hudson, but we need to work a little bit more in Marlborough to establish those relationships. In Northborough, when we first started, we had 0 relationship with the school staff. And now I have them emailing me and calling me, trying to, come in and come to this event, or can you help us get this grant for mental health? And so it's an amazing relationship, but these relationships take time, and we've only been doing MetroWest Moves for 2 years. So if with more time, we'll get the 3 communities to that place, but certainly the schools are a challenge.
And have you been doing peer exchanges between the schools and the 3 communities? I'm just curious.
Yes, absolutely. In fact, that's how in Northborough, it started with one school changing their recess policy to be before lunch, and then the other schools said, well, hey, I'm not going to let that one school get all the attention and the glory. And so the next year, 2 more schools bought on, and then this last year, the final school. So, it kind of gets back to that finding the good leader, but absolutely we share that information from sector to sector or community to community.
Can I go? Oh, sorry. Can I go here first and then I'll go around?
Okay,
Right there.
that's representative. Just curious about the efficiency of the regional coordination. I mean, you talked about a lot of challenges in getting 3 towns to work together, and it takes more coordination in some ways than doing it one town at a time. So has there been demonstrable money savings in having it be 3 towns at once, and how big could this regional cooperation be? Can this be scaled up, or is this about the right size? Or just curious about it, all that.
I absolutely think that it's been a success as far as the regionalization, because again, it gets back to that kind of peer discussions. So, when you have the 3 communities, planning boards sitting at the table together, they can talk to one another, and that's allowed us to be able to be successful in 2 really, competitive grants. So as far as that goes, I definitely think that that's been a success. I will kind of give credit to the coordination team concept. I don't think that we would have been as successful if we would have had an individual trying to, in some cases, herd the cats. We've had several people working at one time, going out and building on our strengths. So rather than have one full-time employee doing something, we have bits and pieces of several people, again, so we can build on their strengths, and we're not teaching people new skills, and there's not really a learning curve. It's, how to do this, go get it done. So I think that that's been really successful. As far as how big it could go, I think that if there is interest, certainly we've had interest from Southborough, Natick, with the tobacco regionalization, there were 9 communities interested. They came together, we wrote a grant, and so I think with interest and the resources, I think it's definitely doable and possible.
Yeah, I was just kind of curious whether it would make more sense to have little clusters of 3 towns like all around the state, or whether to try to spread it out into 20 towns together. Maybe the small clusters is the best way to go.
So just to add 2 things, I think, and I kind of heard what you were saying too, is just the level of service that you're able to offer when you do that type of grouping, because you could do it municipal by municipal, but you do end up getting like maybe one person with one particular strength. But when you leverage them together, the level of service you're able to develop either in a team approach or with other technical assistance providers, I think is much more efficient because you can bring those people together at one time as opposed to multiple times. The other thing I would offer too is that, just to kind of, again, from us looking even more at a larger regional perspective, is that sometimes adjacency isn't the only geography you can use. So just like the issue that we're dealing with here in terms of the different town structures and a city, that sometimes if you look at towns that have similar characteristics, you can bring them together. And they may not be next to one another, but if you look at them that way, that they have similar size, similar structure, similar issues, you can also do a regionalization that way too, to kind of, again, deal with these pictures. So in this way with CTG, we were limited by Middlesex County because we had to apply on the county behalf. But I think this idea that it could become something that reflects certain towns, certain cities, certain community types.
And if I may, I wanted to just say that usually for the Mass in Motion programs, it's 60,000 per neighborhood. So it would be like a Somerville would be having 60,000. We got the 60,000 from the Department of Public Health, but we matched it at MetroWest Health Foundation. So it was 120, but it was for 3 communities that we were working with. So it was a little bit different. It was the oddball out. But I think in just being newer and a little bit, everybody came to the table with some openness. And I think that was also something that was great, and what made this successful from the beginning is even getting those communities to begin to think about it, because they never really worked together before. It was a brand new partnership. So
yeah, and I also think just being able to say that you're part of this statewide Mass in Motion initiative carries a lot of weight. No pun intended, but trying to reduce weight. But yeah, I mean, that really helps to get the decision makers on board and to say, your community is going to get a lot of attention by being part of this statewide initiative. So that's been really beneficial. And we do, through DPH and MAPC, get to hear what other communities are doing and some of the struggles that they've had to try and kind of get around those in our own communities.
And I have 2 questions. We'll go here.
So I'm just kind of curious about more specifics on the cross-sector collaboration. So my East Boston-based Sicilian grandparents taught me how to cook and eat with oil.
Oil's good.
And well, depends on the kind, not their oil. And as the parent of 3 Northborough children who are reportedly and surprisingly not obese, I'm curious what other things we did in Northborough. So you mentioned the school recess, which I heard about from them. I've also seen Healthy Northborough all over town. Those are the only 2 things, though, that I can point a finger at and say, I know that there was something going on here. What other things happened that I wasn't aware of? And is there an opportunity to involve other civic organizations like, say, Scouts, Girl and Boy Scouts, which I'm a Cub Master, didn't hear anything, would have been a good opportunity maybe. What other types of organizations could get involved?
So we did work with the Boy Scouts. Boy Scouts built 9 or 10, no actually I'm sorry, 20 community garden beds in Northborough. So we have been working with the Boy Scouts to help with that. We also, through the town planner, the Boy Scouts have helped to build benches along some trails so that folks can, take a walk, but then also relax a little bit. So we have worked through them. We worked to survey school staff members on their practices and behaviors as they related to a list of national policy standards. So for example, giving candy as a reward, using PE or I'm sorry, recess as a punishment. So if you're bad, then you don't get to go out on recess. So we were able to identify what was going on in Northborough, to use that to help to establish a whole list of about 20 different wellness guidelines that the superintendent put a stamp on to say you will not use bad behavior for a punishment for recess. All kids should have access to daily drinking water. So that was another really huge thing that we did in Northborough. Each elementary school and the middle school, actually and the high school, they all have schoolyard gardens. That's been a part of it. As I mentioned, the community gardens, their big recipe boxes, huge community garden network of the gardeners as far as sharing the recipes. We have also worked at the high school on their garden to give food to the food pantry. So I could keep going. Northborough is amazing. They've done a lot of really great work.
Is it over? I mean, we moved on and now they're doing it themselves, or are you still working with them?
I still work with them. I hope it will never be over. We are thinking of new opportunities as far as talking to the school staff. We recognize that mental health is a huge concern, and so we're trying to see how we can expand beyond the obesity focus to try to address some of the other concerns that the community members have.
But sustainability is an issue, and I think that it's going to be an ongoing issue around these programs. So fingers crossed. I think that that's a local environment that might be able to do some work on their own too once they've gotten some of the supports.
Yeah, well, I mean, certainly, if I go away, the recess before lunch policy is not going away, the list of 20 guidelines is not going away, the gardens aren't going away. So all the work that we've been trying to do in MetroWest Moves and in Northborough is work that's not programmatic, and that it will have a life without a coordinator if I should go away.
Thanks. I know I was also thinking about the other communities as well with Hudson, Marlborough, and Framingham. But we had another question.
Kind of a quick one for Barry. Did you at any point experience any pushback around this being outside your role?
Not yet. I mean, I guess to me, in some ways, it's almost made what we do more accessible. Because I don't know if you've ever met somebody who works in planning at a party, but usually most people's faces go blank and say, yeah, that's great, and they move on. But when you talking about kind of the social determinants of health and how the neighborhoods we live in, the places that we work, ultimately are really affecting our health outcomes. So a child will be healthy because of the school they're going to, employment opportunities you get. I almost feel like it's made a little bit accessible. And just real quickly, as a planner, the history of public health and planning are really intertwined, if you weren't familiar. So essentially all those issues that we dealt with in cities when people looked at infections and crowding and tenements, that led to this thing. Although we diverged, we've now found a lot of our intersections. Okay, get to. So it is funny. I haven't got it yet. Although I will say that sometimes defining where we are in the space is important to figure out too, because you could get into clinical very quickly. You can get into other areas really quickly, and so staying focused on what we address best is, I think, a challenge. Thank you.
I would also just add in other project experience that I have that as a public health person, we're trying to sell the message of partnering with planners or the mayor or economic growth and development. It's not always about the health, as you mentioned. So you might try and sell it to them about health. We try and sell it to them. You're gonna have a more economically vibrant community. It's going to be a place where people are going to want to come and spend money. So that message has been helpful in trying to get non-public health people to the table with us as well, because they don't all get it like Barry and his group.
Any last questions?
I was just wondering if there are any plans for either short or long-term evaluation on these strategies, and if so, who drives that?
So so there is evaluation, as long as for the community transformation grant, CDC has a very, very strong evaluation framework that's behind the scenes driving all this and tracking all those. So Tammy can tell you the amount of reporting that they have to do
and
to
I
keep track
think
with all this. Yeah.
in terms of sort of health and sort of the sort of cost containment and sort of patient outcomes and being accountable for patient outcomes, sort of the cost, so what you save in healthcare costs in terms of chronic disease, sort of we're really starting to see that there needs to be a demonstration to CDC, which is very hard in a short period of time because it's a long-term issue. How do you document cost savings in a short period of time?
And the other thing, I think
Don't envy you on that one.
but I would say that it's also put a great emphasis on process outcomes. So it's again to have those end outcomes, but the process outcomes of showing that these changes are occurring through the investment that's being made is really important.
And they have a really intense evaluation process. I don't know the details of it, but I can tell you they're doing population-wide data collection by telephone calls, and I don't know how it's going since I've left the foundation, but I have to say that it was pretty impressive when it was first getting laid out in terms of how they were evaluating, and they're really trying to create something that they can give back that is going to make a difference in this work doing childhood obesity prevention work. So thank you all for being here.